Jupiter Media presents Avasar, telecasting global opportunities.
Namaste and welcome to Avasar program, the Opportunities Show, presented by Jupiter Media on News 24 television. Today's episode is both inspiring and insightful, a story that breeds medicine, education and human compassion. We are honored to welcome Dr. Cohen, a distinguished medical professional from Israel, an obstetrician and gynecologist, an educator and a global health advocate, whose journey reflects a deep commitment to the transforming healthcare through education and innovation. Dr. Cohen is visiting Nepal to engage with the health and the education institutions to share experience, exchange idea, and explore collaborative growth. So, what brings her here? What inspired her commitment with Nepal's healthcare and education sector? Let's begin with her story. Welcome to Nepal, Dr. Cohen.
Okay, thank you, Sunil and Jupiter Media for this opportunity.
Thank you so much. We are quite happy to having you in this platform so that we can talk lots about your experience and how it will help to the Nepalese medical professionals. So first of all, would you please share your purpose of Nepal visit and what inspired you to engage with Nepal's health and the education sector?
Thank you. I came to Nepal from Israel, where I work as a consultant obstetrician and gynecologist at Carmel Medical Center in Haifa. The choice to visit Nepal was not accidental, as Nepal and Israel have shared a warm and long-standing friendship over many years. I arrived as part of my family journey with my husband and 3 of our 6 children to learn about different countries and culture. During our travel, we explored the beautiful landscape of Nepal and met many kind and inspiring people. This experience motivated me to connect more deeply with the local health and education system. I wanted to learn from Nepal's dedicated healthcare professional and share my experience with them. I truly believe that by learning from each other, we can make healthcare stronger everywhere.
You have an impressive academic background from the occupational therapy to the doctor of medicine specialization in obstetrics and the gynecologist. How did your education shape your approach to the patient care?
My background in occupational therapy taught me to see the patient as a whole person, not just a medical case. When I became a doctor, I tried to combine scientific knowledge with empathy and good communication. For me, patient care is not only about treatment, but also about listening, understanding, and build trust.
Let's have a talk about the teaching and preparation. As a physician experienced in medicine education and simulation-based training, what kind of the teaching methods do you believe are most effective in preparing young doctors and nurses?
I think that the best way to learn is through experience, simulation, teamwork, and active participation. When students practice real-time situation in a safe environment, they build confidence and learn to make better decisions. Reflection and feedback after each case are also very important.
You have served as a chief resident and the instructor in Israel. So what lesson from the experience could strengthen medical training in Nepal?
One key lesson I learned is the importance of mentorship. When young doctors feel supported and respected, they grow faster and become more confident. Another lesson is teamwork. Good medicine depends on good cooperation. This value can help improve training everywhere, including Nepal.
Talking about the crisis management and ICU, during your ICU experience and that COVID-19 pandemic, what did you learn about the crisis management and how can medical institutions incorporate those lessons in their curricula?
The pandemic taught me that teamwork, flexibility, and emotional support are essential in a crisis. We learn to adapt quickly and help each other stay strong. I think medical education should include training in communication, teamwork, and stress management, because those skills save lives too.
Many developing countries face a struggle of trained specialists, particularly in maternal and the emergency obstetric care. How can international collaboration help bridge this gap?
Collaboration can make a real difference. During my time at Sidi Memorial Hospital for Women and Children in Bhaktapur, I met many doctors and healthcare workers who were highly motivated, professional, empathetic toward the patient, and deeply dedicated to their work. International cooperation can help strengthen and support such amazing team through training program, telemedicine, and knowledge exchange. But the main goal should always be to build local capacity, empowering local professionals to lead, teach, and continue developing the healthcare system for the long run.
Let's have a talk about the maternal health and education. As an expert in women's health and high-risk pregnancy, what educational reforms or the training initiatives could improve maternal health outcomes in countries like Nepal?
Training should focus on early recognition of a dangerous sign, teamwork during emergency, and good communication with family. Also, investing in continuous education for midwife and rural health worker can save many lives. Small changes in education can make a big impact on outcomes.
You have worked in diverse medical settings. How important is the interdisciplinary learning for the producing the competent and the compassionate healthcare professionals?
It is very important. Healthcare is teamwork. Healthcare is teamwork. Doctors, nurses, and therapists all play a role. When they learn and train together, they understand each other's strengths and challenges. That creates safer, more compassionate, and more efficient patient care.
Beyond clinical knowledge, you emphasize leadership and mentoring. How can medical educators nurture their qualities among students in low resources context?
Leadership does not require fancy technology. It starts with example and motivation. Educators can give students small leadership roles, encourage teamwork, and show them how to care for others with respect and confidence. A good mentor can inspire even in simplest environment.
Dr. Cohen, before wrapping this show, what message would you like to share with Nepali medical students and the young healthcare professionals about building a meaningful career in medicine and contributing to global healthcare?
Follow your passion and never stop learning. Every patient teaches you something new. Even small act of kindness and care can make a big difference. Medicine is not only a profession, it's a calling. Be proud of what you do and keep your heart open to the world.
Inspiration beyond the border. Thank you so much, Dr. Cohen, for your insightful words and for reminding us that education, empathy, and the collaborations are truly pillars of modern healthcare. From simulation-based learning in leadership in crisis, your journey reflects how knowledge can transcribe borders and empower the next generation of doctors and nurses in Nepal. As our nation continues to strengthen its medical education system, voices like your inspiring reform innovation, and the international friendship. Once again, thank you so much.
You're welcome. Thank you.
Today we have talked with the Dr. Cohen about the insightful information of medical opportunities, medical strength, and how we can collaboratively work with Israel. We will continuously provide you this type of insightful episodes in upcoming days. Stay tuned, News 24 Television, and also follow the Jupiter Media's social networks. And if you want to write something about our program, if you want to advise us, you can write on jupitermedia11@gmail.com. Till next episode, stay safe, take care, bye-bye.
OSR, telecasting global opportunities.